of the Philippines. The
Recording in progress.
only Philippine university to be named in the top 100 universities in Asia. This state-run institution is a paragon of education steeped in history and culture. The University of the Philippines system is composed of 8 universities around the country. The oldest of which is the University of the Philippines, Manila, the birthplace of the UP system in 1908 in Padre Faura, Ermita. Its oldest unit, the Philippine Medical School, later renamed to UP College of Medicine, opened in 1905, followed by the Philippine General Hospital in 1907. From the College of Medicine evolved other colleges and units that diversified the university's course offerings. In 1948, UP was transferred to Diliman, Quezon City, leaving behind some health colleges and the College of Arts and Sciences. In 1976, the School of Health Sciences was created in Leyte to offer a community-based, ladderized health education that aimed to help increase the availability of trained health workers in the province. 2 satellite campuses of the school were strategically set up in 2 other remote and underserved provinces, namely Baler Aurora and Coronadal, South Cotabato. The creation of the Health Sciences Center in 1977 brought together all the health units under one roof. The center was renamed to UP Manila in 1983. Today, UP Manila is the recognized pioneer and leader in health education, research, and public service in the Philippines. Among its pioneering programs are university-wide BS Nursing, Master of Arts in Nursing, PhD Nursing, Master of Health Professions Education, Integrated Arts and Medicine, degree programs in Public Health, MD PhD, MA Health Policy Studies, MS Health Informatics, MS Genetic Counseling, PhD in the Health Sciences by Research, and the only ladderized midwifery, nursing, and medicine degree program of the School of Health Sciences. UP Manila's credentials have led to its being the partner of choice of the World Health Organization, Department of Health, Department of Science and Technology, Commission on Higher Education, and other local and international groups to achieve health reforms. UP Manila is the only campus in the UP system that offers education, research, and training in a wide array of health disciplines and professions. The university offers courses in medicine, nursing, pharmacy, dentistry, allied health sciences, public health, health professions education, community health, and the arts, natural, and social sciences. The competency-based curriculum makes it stand out among the other schools. Since 2014, in compliance with the Philippine Qualifications Framework, the colleges are now transitioning to outcome-based education, or OBE. It enables the well-rounded development of students and unlocks their full potential as both health professionals and dedicated Filipinos. UP Manila educates the brightest students in the health professions and allied social science disciplines. Its students consistently top licensure examinations and assume positions of leadership and influence in government, the private sector, academe, non-government sector, and the community, giving them opportunities to shape national policies and programs on health. UP Manila is a pillar in the field of health research. UP Manila ensures that its faculty, staff, and students engage in research as a tool for health reforms to enhance education and complement its public service role. With the help of the National Institutes of Health, the center of and coordinating body for all researches in the university, UP Manila's researches have served as basis for national policy formulation and program planning. UP Manila's firsts in health research and policy include Republic Act 9288, the Newborn Screening Act of 2004, RA 9709, Universal Newborn Hearing Screening and Intervention Act of 2009, RA 10747, Rare Disease Act of the Philippines in 2016. Other advocacies include the studies on liver diseases that led to the mandatory vaccination of newborns against hepatitis B, commercialization of Lagunti and Sambong as proven effective medications for cough and colds based on the results of the National Integrated Research Program on Medicinal Plants, the Ventilator Project, and the Vision Screening Project for newborns and school children. All of these for healthcare improvement. Strengthening this role is its public service function rendered through the Philippine General Hospital, its community and volunteer programs, and scholarly and technical assistance to the government, private sector, and civil society. As the Philippines' biggest government and tertiary hospital, the PGH sees more than 500,000 patients a year from all over the country. It trains thousands of health students and health professionals from within and outside the university. Among its innovative programs are on child protection and poison control and management. Volunteerism is strong at UP Manila. From the very beginning, students are ingrained with their role as public servants. Through the ugnayan ng pahinuod, faculty, students, staff, and alumni volunteers provide health and socio-cultural services that benefit depressed communities and indigent Filipinos. And to further reach out to the larger society, UP Manila offers the Community Health and Development Program and other community-oriented programs. This combination of excellent education, relevant research, and public service has produced thousands of exemplary doctors, nurses, dentists, pharmacists, public health experts, rehabilitation workers, paramedical workers, and more. With more than 100 years of excellent leadership in health, UP Manila is keeping itself nationally relevant and globally competitive by being at the forefront of Philippine health. The challenge may change, but UP Manila's response will be certain, excellent, relevant, and transformative.
Personally, HIV affected me from a personal level where I lost so many relatives to HIV when I was in high school.
I'm interested in how I can track and identify infectious disease outbreaks.
This summer, I got the opportunity to work on an adolescent HIV intervention in Cape Town, South Africa.
I wanted to dig deeper. I wanted to be actually part of the story.
Somebody had to do something, I wanted to make that change. I knew I have to do public health.
I was really interested in Brown because of their focus on learning public health by doing public health.
I like how there are many different research centers that allow different students to find what they're interested in, what they're passionate about.
One of the things that's different about Brown is we've got a lot of faculty and we don't have that many students. It's not that difficult to find a faculty member who's working in the area that corresponds to your interests.
So my first week here, my first class with Dr. Lurie, I asked him after class if I might be able to work with him, and he agreed. He's been helping me develop my research interest, and he's my thesis advisor now.
Brown was so open to allowing me to meld my work with my school experience. So it was going to make it possible for me to do both things at the same time.
What I love about Brown is the multidisciplinary, where it's not just one department. You can transfer and work with other members from other departments like epidemiology, biostatistics, health services.
I think there's several reasons that students choose to come to Brown. Of course, they love the idea of being able to design and to participate in the design of their own curriculum and their own experiences, learning by doing public health. And they have the whole university at Brown at their disposal to develop their skill sets and their knowledge base.
All the professors are incredibly accessible, and a lot of them work in the field. So they're not just academics who have a conceptual understanding of public health, they're actually doing public health all the time. So they draw that experience into their lessons.
I think a central part of our philosophy is that students should be learning both in the classroom and in their hands-on experiences out in the real world.
And in the afternoons, I would get the opportunity to go out to local sites in the townships around Cape Town to see firsthand what all my learning in my classes was doing to have a positive impact on the people in Cape Town was something that was really fulfilling for me.
At Brown, we learn public health by doing public health.
I learn public health by doing public health.
I'm learning public health by doing public health.
We learn public health by doing public health.
I learn public health by doing public health.
The HIV COVID-19 webinar series is sponsored by the University of Philippines Manila, Brown University Training Program for the Prevention of HIV in Vulnerable Populations. This D43 HIV training program began in 2017, funded by a grant from the U.S. National Institutes of Health, Fogarty International Center. The HIV training program is led by Dr. Don Operario from Brown University, along with co-investigators Vice Chancellor Nimia Pimentel Simbulan and Laura Fred Hernandez from the University of Philippines, and Dr. Susan Kuuven and Katie Biello from Brown University.
Before we begin, please be reminded of our house rules. Participants in our Zoom platform are requested to keep their microphones on mute and their webcams turned off. Participants may use the Q&A box for questions and comments related to the webinar at any time. Viewers of the FB livestream, followers of SubSelfie, and Reporter.world may also post their questions and comments in the corresponding platform's chat box. Our team will then forward this to our session moderators. Our moderators will be reading a select number of these questions and comments due to limited time. We value respect and courtesy during our webinar session. Thank you. Welcome to the third session of the HIV and COVID-19 webinar series, presented by the University of the Philippines Manila and Brown University through the NIH Fogarty program. Our moderators for today are Drs. Maria Lisa Antonette Gonzalez and Ricardo Manelastas Jr. Dr. Maria Lisa Antonette Gonzalez is a pediatric infectious diseases specialist practicing in Metro Manila with a master's degree in clinical epidemiology from the University of the Philippines. She is a professor and current associate dean for faculty and students in the UP College of Medicine. Dr. Gonzalez is the immediate past president of the Pediatric Infectious Disease Society of the Philippines, a fellow of the Philippine Pediatric Society, and a member of the Asian Society of Pediatric Infectious Diseases. She has authored and co-authored several research papers and reviews on various infectious diseases topics, and has contributed in the writing of book chapters and modules in infectious diseases, antibiotics and vaccines currently being used by medical students, infectious disease specialists, and pediatricians. She has collaborated with the Philippines Department of Health in the development of technical papers, guidelines and recommendations on tuberculosis, pediatric HIV, dengue, and infectious diarrhea, which has served as the basis for the formulation of policy drafts and national guidelines. Currently, she is the president of the Philippine Foundation for Vaccination, chair of the Philippine Department of Health National Verification Committee for Measles Elimination, member of the Department of Science and Technology Vaccines Expert Panel for COVID-19 vaccines, and a member of the DOH National Adverse Events Following Immunization Committee. Dr. Ricardo Manelastas Jr. is a professor of obstetrics and gynecology of the University of the Philippines Manila. He earned his medical degree from UP-Manila's College of Medicine in 1983. He completed his residency in obstetrics and gynecology and fellowship in infectious diseases at the Philippine General Hospital. Dr. Manelastas holds a Master of Science degree in bioethics from the University of the Philippines Manila. He also served as the coordinator of the UP Manila and Brown University's National Institute of Health HIV Program. Dr. Gonzalez and Dr. Manelastas, the floor is now yours.
Good afternoon, Butch, my co-moderator. Good afternoon, everyone. Good afternoon to our distinguished speakers. Butch, I saw in our participants window that we have people as far as Isabela and Ilocos Norte, and I'm so happy to welcome everyone to this third session of the HIV and COVID-19 webinar series. So this 5-part series will highlight the challenges that the COVID-19 pandemic has brought to the HIV prevention and care continuum, and the lessons that can guide HIV service delivery in the post-pandemic Philippines. Today's session objectives are as follows. So, to describe the development and safety of COVID-19 vaccines, to identify the importance of COVID-19 vaccines to the health and well-being of persons with HIV, and to identify the COVID-19 vaccination rights among persons with HIV.
Good afternoon, Chet. Good afternoon to all of you. As mentioned by Chet, today's session is entitled Who's Next in Line? Considerations and Guidelines in Vaccinating the PLHIV Community. The development and delivery of COVID-19 vaccines have shed light and hope to many communities to eradicate the debilitating impact of COVID-19 pandemic. While this is a critical step to move forward, there have been growing concerns on the acceptance, efficacy, safety, and rollout of the vaccines. The third installment of the UP-Manila-Brown HIV and COVID-19 webinar series tackles issues on COVID-19 vaccination among PLHIV community. The webinar is currently conducted via Zoom and live stream in the UP Manila and the UP Manila Brown Facebook pages. We are being covered live via Twitter through the UP Manila Brown webinar sub-selfie and reporttr.world accounts. Viewers of the live stream and followers of the Twitter accounts may also post their questions and comments in the corresponding platforms chat box. We begin our session with the presentation of our colleague, Dr. Nina Gloriani. Let me introduce Dr. Gloriani. She currently serves as the chairperson of the DOST Expert Vaccine Panel on COVID-19 Vaccine Clinical Trials and is also a member of the WHO Scientific Steering Committee for COVID-19 Solidarity Vaccines Trial. She continues to chair the National Certification Committee for Poliomyelitis Eradication in the Philippines. Dr. Nina Gloriani is a medical doctor with a public health background and postgraduate training in microbial immunology and medical biotechnology. She had postdoctoral fellowships in HIV/AIDS immunology and virology, UCLA in the USA, hepatitis C molecular analysis at Kobe School of Medicine in Japan, sexually transmitted diseases at CDC San Francisco DOH, California, USA, and clinical microbiology, molecular diagnostics at Georgetown University Medical Center in the USA. Dr. Nina retired in 2018 as full professor of medical microbiology and immunology after serving the academe for 37 years. From 2007 to 2013, she served as Dean of the College of Public Health in UP Manila, and at the same time, Director of the Siamo TropeMed Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health. From 1995 to 2005, she served as Director of the Institute of Biotechnology and Molecular Biology of the National Institutes of Health in the Philippines, and from 1995 to 1998 as Chairman of the Department of Medical Microbiology of the College of Public Health. She established the Microbial Immunology Research Group, which addressed seroepidemiologic and molecular studies on a number of infectious disease agents, such as hepatitis A, B, C, and E, HIV, herpes, and Hantan viruses. From 2010 to 2015, Dr. Nina led and implemented a 5-year JICA and DOST PCHRD-funded program for the prevention and control of leptospirosis in the Philippines, wherein her team developed the Leptovax vaccine against 4 leptospira serogroups, serovars, prevalent in the Philippines. This project on leptospirosis was a comprehensive program that included identifying various strains of leptospirae in the Philippines, identifying environmental, behavioral, socioeconomic, and other risk factors for transmission, burden of disease studies, development of diagnostic reagents, vaccine development, and health promotion and education down to the community levels. As a public health professional, Dr. Gloriani has extensive experience networking, leading academe and other groups in biomedical and public health researches and extension services, overseeing and coordinating scientific fora, training various stakeholders in public health emergency management, advocacies for prevention and control of communicable and non-communicable diseases, and for the use and applications of advanced technology in solving public health problems. Although retired, she continues to serve as technical consultant to various agencies in the fields of medical microbiology and microbial immunology, medical technology, and public health. We now give the floor to virtual floor to Dr. Nina Gloriani.
Yes, thank you very much, Dr. Rick, Dr. Chet. And I see a lot of my colleagues, former students, or also now faculty, of course, the UP Manila community. Well, you've heard that I've worked with HIV before, but that was how many years ago? So after I did my postdoc at UCLA. But I'm happy to be here. Thank you very much for inviting me. And I'd like now to share my screen. So I have been asked to just present for 15 minutes. So it was a little difficult to actually cram into 15 slides. Actually, I only have 13 slides. To give you an idea of the COVID-19 vaccine developments and largely safety, although I'll be talking about the immunogenicity and efficacy as well, and now the effect of these variants. Okay, so development of COVID-19 vaccines, safety, immunogenicity, especially among people living with HIV, the efficacy of these COVID-19 vaccines, and the variants of concern, the Delta variant that is now a very big concern. So among the variants of concern, siya yung biggest concern, and some key messages. Okay, so let's just run through ito. It's very, very, summarized form of COVID-19 vaccine development, and then the evaluation, selection, and approval processes. So, you know about this virus. This is how it looks like. This is the whole virus. and there are very specific parts that are very important, especially for attachment to what we call the receptors on the host cells. So ito, no? This is the whole virus. There is this spike, and within that spike, you have your receptor binding domain, this one. And either you prepare the whole virus as an inactivated or even a live attenuated vaccine, or you just use this spike or maybe just the receptor binding domain in order to produce subunit vaccine. So there are many ways by which you can actually produce the spike protein. So we'll run through them later on. So you can use DNA. You can the DNA sequence corresponding to the spike or even just the receptor binding domain. Or, you know, from the central dogma, you have your DNA and then your RNA, your messenger RNA, as exemplified by now your favorite Pfizer and Moderna. And then, you can use actually the pure form, the recombinant protein vaccines, or you can make some of these viruses like adenoviruses, lentiviruses, act as vectors for the genetic sequence of the spike. So you can have an inactivated form, a live attenuated form, or just a subunit. And all of these vaccines go through a lot of, studies and preclinical vaccine development, especially by preclinical. Well, of course, you have your exploratory phase. Preclinical refers to studies in animals. So that's largely for safety, also immunogenicity, and also efficacy. So when everything is fine and the results are really good, then you have your phase 1, you move on to your phase 1, which is largely a safety study, although some phase 1 studies comprising only of a few people tested will also have some immunogenicity studies as well. And if that is all right, it's good, you move on to phase 2. You now have more people being tested, again for safety, but this is the time when you determine the optimal dose for the vaccine and then the large efficacy trials of phase 3. So we were with the VEP, Dr. Chet and myself, the vaccine expert panel. So we do the technical evaluation, then we forward to the single joint research ethics board for, all of these clinical trials should be not only technically sound, but of course they have to be ethical as well. And then the final approval is given by or awarded by the FDA. So we have to assure safety, immunogenicity, and efficacy. So put together, we have actually, this is the whole virus, and that is exemplified by your Sinovac, Bharat Biotech, and I have not included Sinopharm here, but these are all inactivated whole vaccines, And then we have the adenovirus vector-based vaccines. The AstraZeneca is made up of chimpanzee adenoviruses together with the genetic sequence corresponding to the spike. Then we have Sputnik V, which uses adenovirus 26 and adenovirus 5, and Janssen, which uses adenovirus 26. Then for messenger RNA, we have Moderna and Pfizer. So I just placed here the ones that we have EUAs, although we are also looking forward to the Novavax, which is a protein subunit vaccine that should also be made available sometime this year from the Serum Institute of India. So once these vaccines are approved for use, and they are now approved under emergency use authorization, we have to make sure that they are safe, they will elicit the appropriate immune responses, and they will be effective or efficacious in protecting against COVID. So very, very quickly or very simply, measures of safety will include looking at the side effects. We prefer maybe to use side effects other than adverse events or reactogenicity. So this could be local side effects mainly, because all of the vaccines that we have for COVID right now are injectable. So you expect pain at injection site, redness or inflammation, rashes, maybe itchiness, or you can get systemic side effects like fever, headache, or flu-like symptoms. Now, these side effects could be mild, moderate, or severe. Then we will call them serious adverse events, no? But some of them are really expected, especially these ones that I have included here. But others are rare or unexpected, like severe allergy, anaphylaxis is a very rare event, but it may happen. And then we also have what we call serious adverse events and adverse events of special interest. So Bell's palsy, yung mga platelet depletion, yung tinatawag na blood clotting, these were thrombotic events reported to different vaccine safety, monitoring agencies. Blood clots, then I have not actually put here yung myocarditis that has been reported for Pfizer and actually messenger RNA vaccines now. But for all of these are rare, no? But you have to determine causality. Are the side effects due to the vaccine or caused by other conditions that are not related to the vaccine? So when we allow vaccines to be deployed, the benefits of the vaccine must outweigh the risks. Okay, so I'll run through this first, no, before we go into the specific data for the studies among people with HIV. So for after safety, we look at measures of immunogenicity. I believe you are quite familiar with the B cells and the T cells. These are the ones that are involved in, especially B cells. They produce your antibodies, and we specifically would like to look at neutralizing antibodies. But we want to also see that these antibodies that are produced in high amounts, so yung tinatawag nating high titer, and they should stay long in our body, in our bloodstream, no? So long duration of immunity, and we may actually look at memory B cell responses. Now, I just wanted to put here that, most of the vaccines that we have, except for one, yung Janssen, is only one. Most of the vaccines are for 2 doses, and that has value, no? We know that after a primary administration, after the first dose, you only have this much response. Ito lang, konti, like a heal. So then when you boost, you give a second dose, then that will go up. You have a boosting effect because of memory. And then you expect higher levels of antibodies that will not, will not wane very easily. But we are looking at the COVID vaccines that we have available now. So we may need later on a third dose or a booster, but right now we are not recommending it. Now for T cells, we also, antibodies will may protect, but right now we are not very clear about the immune correlate of protection. We are actually looking also at T cells. So merong memory T cells, and specifically we are looking at what we call helper T cell responses. So makikita nyo later yung interferon gamma, especially in the AstraZeneca study that I will show. Then we have also another one, interleukin 2. Now, here, I tried very hard to actually get data na talagang published, no? So the one that I saw was that of AstraZeneca, which was published last June 18 this year. So this AstraZeneca COVID-19 vaccine is a single-arm, open-label clinical trial in people living with HIV. This was done in UK for safety and immunogenicity. So very small trial, only 54 eligible participants were enrolled. All were HIV positive males with a median age of around 42.5 years. All of them were on antiretroviral therapy, and they had undetectable plasma HIV viral loads less than 50 copies per ml. Although later you will see sa Pfizer, ang kanilang cutoff was less than 40 copies per ml. Then CD4 counts of more than 350 cells per microliter. And for these patients, 54 of them, The median CD4 count at enrollment was around 700 cells per microliter. So ito yung from 500 to around 900 cells per microliter. So this is relatively good, no? Then they were given 2 doses of the AstraZeneca 4 to 6 weeks apart. Then all outcomes were compared with HIV uninfected group from the main. They have a bigger COVID-002 study with the same age group and dosing strategy. And a lot of the endpoints were reported until day 56 after the 2 doses. So let me just run through the safety results. So maganda to, the study, no? Only, of course, it's only 54, but still, there were no serious adverse events reported. The local and systemic reactions occurred during the first 7 days, the frequencies of which were similar to the HIV negative participants. So the most common, as I already mentioned earlier, no, syempre, injectable siya, pain at the injection site in 49%. Then yung mga parang flu-like symptoms, fatigue, headache, malaise, chills, muscle ache, joint pain, nausea. So, and then for immunogenicity results, they tested or determined levels of binding antibodies against the spike, no? That yung spike na yon. No, so they're showing here that the antibodies peaked at day 42. I'll show you the figure later, with a median of 1,000, mataas ito, no, for the ELISA units, 1,440 ELISA units, and these were sustained, the antibodies were sustained until day 56, although medyo bumaba yung iba to around 941. Now, they also tested yung interferon gamma to an ELISpot assay, so ito yung T-cell response, so because we want to also see that these vaccines are able to elicit T-cell responses. I'll show more of that later in a while. And then, but compared with participants without HIV, the study found no difference in magnitude or persistence of the spike, specific humoral or cellular responses. Normally, we would expect that the ones with HIV will have lower responses, but in this particular study, where they tested 54, it was the same level that they found with the HIV positive and the HIV negative. So the interpretation in this study of people with HIV is that the AstraZeneca COVID-19 vaccine was safe and immunogenic, supporting vaccination for those well controlled on antiretroviral therapy. So I just wanted to put, I'm fond of color. So just to show you, this is how they usually would report. So ano yung after the first dose, this yung red ang HIV positive, ito yung HIV negative, and then after the second dose. So pain ang most frequently reported, tenderness at the site of the injection, and warmth, yung mainit. Siyempre pag may swelling, it will be warm, no, to touch. And then do sa systemic, you have chills, fatigue, may konting fever, konting-konti lang yung nagka-fever, but merong feverishness na reported, headache, joint pain, malaise, muscle ache, nausea. And you note that they will not last very long, usually nasa within 7 days. Most of them actually within maybe 3 to 5 days. And then these are for the immunogenicity studies. Ito yung individual responses to 54, no? Pero if you look at the group responses, you note that the highest response is at day 42. So usually your antibody titer will rise, and in this case, for this group, the highest levels were at day 42, sustained to day 56. And if you look at yung comparison between HIV positive and HIV negative cohorts, they do not differ much. Itong red ang HIV positive, and then yung HIV negative itong green. So halos pareho lang sila. Then in terms of T-cell responses, the T-cell responses peaked earlier at day 14. So medyo bumaba na ng konti. Pero you see here, sustained pa rin dito. Ito yung interferon gamma that was tested via yung ELISpot assay. And then these were yung CD4 positive and the proliferation of either CD4 positive cells to the spike protein when stimulated yung PBMCs and the CD8, makita nyo na nasusustain sila up to 48, ano ba to? 14, 28, 42 hanggang 56. It's not too bad, no? So actually maganda yung result na to with AstraZeneca. So there is this other one, no? Itong Pfizer. Ito naman, this was done in Israel. It's a profile of 143 participants, 50 years and older, mostly 92% men. The CD4 positive cells were at least 700 cells per cubic millimeter of blood. They were all on antiretroviral therapy, so stable on antiretroviral therapy. With viral load, yung cut-off nila, ito yung sinasabi ko, 50 yung cut-off doon sa Astra, sa kanila less than 40 copies per ml. So, in this, now you have more participants here. 14% ng 143 had comorbidities, hypertension, cancer, hepatitis C, co-infection, no? Chronic kidney disease, obesity, and a few, I think, nagka-stroke pa. Then they use as control subjects 400 HIV negative healthy healthcare workers. They were also given 2 doses. Hindi sinabi kung 21 days apart kasi yung Pfizer that we're using is given at 21 days apart. So ito several weeks apart. I don't know kung na iba-iba for some of these participants. Now take a look now at the safety results. So halos pareho lang, no? Local side effect, ganun din, mild pain at injection site which resolved in a day. After the first dose, fatigue and headache were common or reported. After the second dose, fatigue and fever were also common side effects. There were 3 HIV positive participants who experienced tingling sensation sa face, yung isa sa vaccinated arm, yung isa both arms, but this resolved within 48 hours. And 2 had an increase in liver enzyme levels, which resolved within a few days. So by safety, we really monitoring all of these side effects and for how long they will stay, and yun nga kung mild, moderate, or severe. Now, for immunogenicity results, they now here reported on the seroconversion rate. So by that we mean how many of these vaccinated individuals actually produce antibodies, yung 4-fold increase in antibodies na tinatawag natin. 14 days after the first dose, kalahati doon sa HIV positive, pero halos ganun din doon sa HIV negative. Then, 18 to 28 days after the second dose, of course, you expect a boost in response. So, nakita nyo yung seroconversion went up to 98% among the HIV positive and dun sa HIV negative, 99%. So, mukhang wala naman difference doon sa dalawang groups. Now, the antibody levels from both HIV positive and HIV negative groups were around 5 times higher after the second dose compared to the first dose. There were 4, no? So marami tong sila, but there were 4 HIV positive participants who had no antibodies after the second dose. So they had to look at the profile of these participants. So one was a 66-year-old man with kidney transplant on 3 immunosuppressive drugs. Another one was a 58-year-old man on dialysis. Merong 72-year-old man with coronary artery disease. And there is this 64-year-old woman with arthritis taking colchicine who developed severe COVID-19 4 weeks after the second dose. So what we're trying to say here is if you're on immunosuppressive therapy or anti-metabolite therapy like colchicine, of course, yung mga nasa dialysis, yan yung mga immunocompromised na rin. So, they did not produce antibodies even after the second dose. But they found 12 people with yung less than 350 cells, yung CD4 positive cells per cubic millimeter, and 3 who had even less than 200 who produced high levels of antibodies. No? So that was very good. No? But in this study, they did not perform T-cell mediated immunity assays. So it was not determined. But given the seroconversion rate and the antibody levels being 5 times higher, then that looks good. Okay. So now I'll just move on to the flavor of the week or the weeks or day. Just want to maybe drive home the point that everyone should be very careful these days, more careful than even before. So I put in here how many? 1, 2, 3, 6 pala. 6 numbers, 6 data sets. Showing that, of course, we now have more cases, but maybe what is worrying is, of course, we have the variants of concern, these 4, alpha, beta, gamma, delta. Alpha is from UK, beta is from South Africa, gamma is from Brazil, and delta is from India. And theta is the one we have here in the Philippines. Makikita nyo, tumataas pa rin. But gamma, which is the Brazil variant, has remained, mukhang hanggang 2 na lang. Mabuti naman, no? Hindi siya dumami, but take note, we have more of the beta variants, then followed by alpha, but delta ay halos dumadami na. Ito yung nagda-drive ng ating spikes in cases now. So why variants of concern? Why concern? Because this the variation, the mutations that occurred in these viruses na naging variant of concern na allowed them to behave differently. So the most important behavior that we do not want is that they have increased transmissibility or they have become more infectious. If we look at yung data, may yung Delta variant, viral load daw, ito yung very recent na lumabas na information, is 1,000 times higher than earlier viral strains sa when you do your swab, no? Marami talaga, tapos highly transmissible, madaling mag-attach, and it has to do with yung pag-bind niya, yung mutations niya allowed the virus to change its shape, its conformation, and allowed it to attach more easily, faster doon sa host cell receptors, yung ating ACE2 receptors. Now, in addition to increased transmissibility, yung impact on vaccines. So, yung mga vaccines that we have are first generation vaccines. So, we have shown reduction in vaccine efficacy when we are dealing with variants of concern. So, depende kung ano yung variants niya. Sa South Africa, they have studies on the South African variant, or sa Brazil, and then yung sa Delta now, all over the world, halos lahat, nasa mga 70 to even 90% of the cases are due to the Delta variant. But in addition to being more infectious or will reduce vaccine efficacy, some of these variants can actually cause more severe disease. And we're seeing them especially among the immunocompromised individuals. And then some may resist antiviral agents, so but thankfully the reports are not that many, but there are reports of the variants actually resisting antiviral agents and some escaping laboratory detection. So how will that affect now this efficacy? So it is very difficult to discuss efficacy, effectiveness, but I just wanted to put here all of this data, showing yung data for the vaccines that we actually have or may have here. So Pfizer, AstraZeneca, Sinovac or Coronavac, Sputnik V, Moderna, Janssen, Covaxin is the Bharat Biotech inactivated vaccine, and Sinopharma is inactivated vaccine there. Okay. So ito yung una nilang lumabas na mga efficacy from clinical trials, no? Pfizer 95%. AstraZeneca, nasa mga 70%. Sinovac, depending on the study, kung saan ginawa, Actually, tumaas na yung from 50 na pinagkakaguluhan natin before, 65 to 91% based on Brazil, Indonesia, and Turkey trials. Sputnik, very high at 91.6%, Moderna at 94.1%. Yung Janssen is only one dose, no? Pero below 70% ang kanilang efficacy against moderate to severe or critical COVID-19. Yung Covaxin, the Bharat Biotech has a recent publication saying 80.6% ang efficacy niya against PCR-confirmed symptomatic COVID-19. And for Sinopharma, it's close to Covaxin. Halos pareho, no? 78% in the general population, adult population. Now, itong middle column here is the efficacy against the disease or hospitalization. All of these vaccines are actually better at protecting against the more severe form than against yung overall any symptomatic COVID lang. So, 94 actually up to 100%, 94, 85.5% against severe disease, 100% against severe, including hospitalization, and for Sinopharm, it's also almost the same. Then, putting together, ito yung protection against the variants. Now, these data are evolving, no? So, some of these vaccines have data on yung pag nabakunahan ng first generation vaccine nila, ano ang effectivity or effectiveness, the protection against various variants. So, Pfizer has data on the Alpha, Beta, and Delta variants, so they continue to be effective, although all of this bumaba from 3-fold to about 6-fold, bumaba yung kanilang efficacy. But they're still okay. So AstraZeneca has studies on the effective pa rin sila against Alpha and Delta variants. Sinovac is effective against Alpha but has decreased neutralizing antibodies for Beta variants and Delta. I remember that's about 6-fold reduction. Then for Sputnik, hindi clear, wala pa yung talagang actual detail ng data, but they're saying likely to retain strong efficacy at preventing severe COVID-19, even in the case of infection by variants of concern. So yung Moderna, they have studies, so effective pa rin against Alpha, Beta, and Delta, both using in vitro studies and clinical trials. And then yung Janssen, mayroong studies, the effective sila against Beta and Delta. Actually, yung mga studies are relatively recent, especially yung galing sa South Korea. Then Covaxin is effective against Alpha and Delta variants, and Sinopharm has data against the Beta variants. So, what I'm trying to say here is nabawasan yung mga protection, but they still are able to protect yun nga, 3-fold to 6-fold reduction in the neutralizing antibodies. Pero they should still be able to protect, especially against the severe form of COVID, against hospitalization, and against death. Okay, so this is my last slide. So the key message here, only a few slides to know. Now, we're looking at the HIV population in the context of their impaired immune systems being at higher risk for the more severe form of COVID-19. But we're also looking at COVID-19 vaccines being able to decrease the chance that people living with HIV will become seriously ill with COVID-19. So we give vaccine, these people with HIV may not become seriously ill with COVID-19. Current data from the clinical trials studying these vaccines only included small numbers, as I showed earlier, and we still need further duration of follow-up and maybe more subjects, although there are now more studies about them. And in fact, here in the Philippines, there is going to be a trial for HIV-positive individuals by a certain company, vaccine company. We are waiting for their data. But so far as we know, the COVID-19 vaccines have been shown to be safe for people living with HIV and will slow the spread of the coronavirus. Now, the vaccines available right now are not live virus vaccines and thus less likely to pose a safety concern to HIV patients. But in case the live attenuated vaccines become available, they will not be recommended for HIV positive individuals and those who are immunocompromised. The medical professionals agree that the vaccine will not interfere with any HIV-related treatment of care. So nakita nyo naman yung mga sumali sa mga trials, they were on antiretroviral therapy and they were still able to generate the immune responses, the appropriate immune responses. But we have to also explain that the possibility of a weaker immune response to the vaccine is there. So, pwedeng hindi ganun kataas, although the AstraZeneca was saying pareho lang sa HIV positive and HIV negative, but there is that possibility, but not just for HIV positive people, but other people na immunocompromised, no? Talagang yung response nyo to the vaccine may be lower. But any amount of protection that may be afforded by vaccine administration would provide potential benefits outweighing the potential risks. And then, thank you very much for your kind attention.
Thank you very much, Dr. Nina Gloriani. Ma'am Nimia is being kept busy by the DOH and PCHRD because of all of this COVID-19 vaccines coming in, Ma'am Nina, no? But yes, we have already more than 500 participants, 512, and still increasing. We have a few questions already, Ma'am Nina, in the Q&A box and in the chat box, and we are going to be reserving all of these questions for the Q&A later in the open forum, no? So our next speaker, who I would like to introduce, is Dr. Angelo Juan Ramos. So Dr. Ramos is the Executive Director of Sustained Health Initiatives, or SHIP Incorporated, a Manila-based NGO that works to close the gaps in HIV service delivery. So he is a physician and public health expert. Dr. Ramos has more than 15 years experience in public and community health. Dr. Ramos currently leads a USAID PEPFAR-funded project for SHIP, setting up new community-run primary HIV clinics in the greater Metro Manila area. With these SAIL clinics, SHIP is providing differentiated and client-centered delivery across the whole HIV cascade, from prevention, testing, diagnosis to treatment and management. Dr. Ramos, the virtual floor is yours.
Thank you very much, Dr. Gonzalez. And of course, I'd like to thank UP Manila, Brown University for inviting me to take part in this webinar. So let me just share my screen. Right, again, good afternoon, everyone. So for this afternoon, I'd like to talk about COVID-19 vaccines and their effect on the health and well-being of people living with HIV. So my presentation is really based on our experiences working with people living with HIV, in our primary care clinics. So as I mentioned, we have our SHIP clinic in Mandaluyong and our two new SAIL clinics in Makati and also in Cavite. So based on our experiences as well as the latest guidelines, that we are getting, we have been guiding and advising our patients, at least in the past year during the COVID-19 pandemic, and now that vaccines are now being rolled out across the country. So I'd also like to approach this topic through a primary, health care perspective, and our clinic and as well as many HIV treatment hubs, really adopt this holistic care, for people living with HIV. And it is through this holistic care that we really practice what we call differentiated client service, client-centered care. And we also look at the socioeconomic and cultural determinants of health for many of our clients, because we do advise our clients right now to really, get vaccinated against COVID-19. And this is really a very important no, for their health and well-being. Pero yun na nga, vaccines are just one component for health and well-being, and we must really take into consideration other factors, especially yung mga socioeconomic and cultural determinants. And when we advise our patients about what's the latest about COVID-19 in terms of the risk and also in terms of the vaccines, we constantly tell them that we are really guided by yung current protocols and current guidelines, and at the same time, since this is all new, these guidelines and protocols are constantly evolving. So, for example, just this July 15, the WHO, the World Health Organization, came out with a statement. They said that HIV infection is now a significant independent risk factor, for the development of severe and critical COVID-19 infections, that can lead to hospital admission or even mortality. So the same report, which they say is based on latest studies, also mentioned that there's actually a 30% greater risk, in PLHIVs to develop these severe symptoms, and also can lead to fatal COVID-19, when you compare it to the general populations. But having said that, the same statement also says that it's actually for people living with HIVs, there's a lot of common underlying conditions and risk factors that they've also seen. So, for example, for many PLHIVs who are male, who have also these risk factors of being 65 years old or older, and also underlying conditions like diabetes and hypertension, this can really increase the risk for people living in HIV to have severe COVID-19. Which is why it's really very important, for us health practitioners, and also healthcare providers to really recommend vaccination for people living with HIV. So we can cite, for example, from WHO, as Dr. Glory mentioned, talagang there are already a lot of vaccines available here in the Philippines, and the WHO itself already recommended these vaccines, yung AstraZeneca, J&J, Moderna, Pfizer, Sinopharm, or Sinovac, And the general recommendation then is magbigay na tayo ng vaccines, i-vaccinate ang ating mga pasyente with HIV regardless of their CD4 or viral load counts, And we also, for those patients who are hesitant or are a bit fearful in terms of the effects of the vaccines on their bodies, we provide them advice na so far, of all of these available vaccines in the Philippines, none of them contain live viruses. And in the case of yung mga mRNA viruses, we need to just reassure them that these kinds of vaccines do not actually have genetic materials that can replicate these viruses in our bodies. At the same time, we can also reassure them that these vaccines do not have any pharmacological interactions with the antiretroviral drugs that they're already taking. Here in the Philippines, the latest recommendations coming from the Department of Health, is they also say that all vaccines are safe and they provide protection against severe COVID-19. And they've already included PLHIVs as part of yung A3, na priority group for vaccination, which includes immunocompromised patients as well as those with pre-existing medical conditions. However, the recommendations also say that they encourage people living with HIV to get clearance muna from their physician prior to vaccination. On the side naman of PSMID, or the Philippine Society for Microbiology and Infectious Diseases, they also highly recommend that PLHIVs and other immunocompromised patients get vaccinated. Pero they also recommend na meron ding medical clearance from a physician. And they also say that we really need to communicate that the benefits outweigh any potential harm, as Dr. Gloriani also mentioned. And this will provide protection against COVID-19. Pero yun na nga, the efficacy of the vaccine might be lower in some patients living with HIV, especially those who have maybe low CD4 and low CD4, and those who are also still have high viral loads o yung hindi pa po mga undetectable. Okay, so which brings us to the point that we need to really communicate to our clients or patients who have HIV, that if you're familiar with the Swiss cheese model, on how to protect ourselves or how to defend ourselves against viruses, so yun na nga, if you're familiar with Swiss cheese, ito yung queso na may mga butas-butas, so that it just means that not using just one intervention will really not protect us from COVID-19. So we need to have all of these different interventions, that we can advise to our clients, and vaccines, however important, is just one slice, of the Swiss cheese defense, So we still need to tell our clients and our patients talagang they still need to do all of these personal interventions, yung mga physical distancing, masking, etc. And at the same time, we also need to communicate with them that, for example, vaccines are very important. They need to get vaccinated because they have a responsibility, not to transmit the virus to people in their community, their families, and their loved ones. Sorry. So again, this is still very important for us to keep really communicating with our patients, the safety basics for COVID, hand washing, physical distancing, cough and sneeze etiquette, not touching other people, touching your face. And it's also very important to always wear a mask when you go out, especially when you go to indoor venues, as well as when there are a lot of people. And for people living in the HIV, it's also important that you also give them advice on maybe these additional slices of Swiss cheese that they need to also take into consideration, comparing, for example, the general population. So things like, again, general prevention. And at this time, especially, we are going to have another ECQ by the end of next week, so they need to make sure that they still continue their ARVs, taking their ARVs. They also need to now communicate and talk with their respective HIV clinics. Now they need to start stocking up on the ARVs, So siguro for this period they need to have at least a 30-day supply. Ideally, meron sila yung tinatawag na multi-month dispensing, so they don't need to go back to the clinics and travel as often as they can, And of course, they need to be updated with their vaccines, like flu vaccine and also for pneumonia. And yun na nga, with the lockdowns, with impending lockdowns, so they need to have a plan in place, For example, if they develop symptoms, saan sila mag-stay, saan sila mag-isolate, and meron ba siyang tamang people that can help them? Will they be isolated, by themselves, and how will that affect their mental health? So these are things that need to take into consideration, and they really need to look after themselves. This is also very important advice in the time of COVID, that they need to eat right, balanced diet, exercise, and also I need to also underscore the importance of really taking care of their mental health. And us as health providers, we need to give them those resources and even link them up to expertise on helping them manage their mental health, especially in these very trying times. So quickly, I'd just like to maybe share with you, again, from our experience, ano yung challenges nakikita namin in terms of PLHIV getting equitable access to vaccines at this time. So for example, we have these challenges that we need to, for example, make sure that the privacy and confidentiality of our clients are being observed, and syempre they don't experience further stigma and discrimination, kasi this can be a double stigma. For example, you already have HIV, and they might also have COVID. So what strategies can we do here? So maybe for the longest time, we have been advocating to DOH that they include primary care clinics and HIV treatment hubs as COVID vaccination sites. So there are already some examples in some, for example, mga social hygiene clinics in Cavite, na they already are becoming COVID vaccination sites. But it's good if DOH can allow and provide supplies to HIV treatment hubs, so we can do these vaccinations with our clients para yun na nga, na-ensure din yung kanilang privacy and confidentiality. Ano? And as much as possible, hindi i-require na mag-disclose ang mga clients natin. Ano? For example, they need to bring a medical certificate na nandun yung kanilang status, or kailangan kailangan magpakita sila ng mga latest CD4 or viral load results. No? So hopefully, hindi na required yun, no? And in some venues, it's best na kailangan hindi segregated yung mga pila ng mga clients who have HIV. Siyempre, baka they would undergo discrimination there. No? Magtagal din ng mga sign na this is the pila, this is the line for PLHIVs. No? So we need really to not do that. No? And it's very, very important now to counter this information that's happening. That is really compounding the fear and the hesitancy of our people living with HIV to get vaccinated. So this is really a difficult battle. It's very challenging for us on the health communication side, but this is something that we really need to maybe improve on. So we need to really increase the awareness and strengthen the way that we communicate to our clients and even those yung mga key populations who are at risk for getting HIV. So if we need to reach them out on Facebook, on Twitter, and other social media, because there's a lot of noise out there and a lot of disinformation about COVID-19, about vaccines, and even yung mga purported na mga cures for COVID-19. So we really need to strengthen the way that we reach out to our clients, and we need to communicate in a way that we assure our clients that vaccines are safe and very important, not only for themselves, but for the people around them. Another issue and another challenge would be the timeliness and availability of these vaccines. So that's a big issue right now, yung availability. So hopefully we can ask government agencies and LGUs to prioritize PLHIVs. And at the same time, there are good examples and strategies wherein private sectors and the NGOs, for example, like Love Yourself, have been working with LGUs, for example, like Mandaluyong. So Love Yourself, for example, has partnered with Mandaluyong so that yung mga PLHIV at yung mga key population clients nila, kahit hindi sila taga Mandaluyong, they are able to get vaccinated in Mandaluyong because of this partnership. And again, I'd like to underscore the importante rin na yung continuity of care, tuloy-tuloy lang. So at this time, na magkakaroon ng ECQ, we need to start maybe ensuring that our clients with HIV get easier access to ARVs. And then, now is not the time for them to change their regimens unless talaga there's a very compelling reason to do so. And we need to continue helping them manage their pre-existing conditions. And of course, syempre, yung mental health should also be really watched. And of course, finally, talagang yung mga personal precautions need to be constantly practiced para talaga maiwasan ang transmission ng COVID-19. So with that, I'd like to thank you all for listening and stay safe, everyone. So have a nice evening, everyone, and take care.
Thank you very much, Dr. Ramos. Excellent presentation as well. Hope you can stay with us for the open forum after the next speaker. Yeah. Our next speaker is Ms. Amara Quesada. Ms. Quesada is the Executive Director of Action for Health Initiatives Incorporated, otherwise known as ACHIEVE. She has led this organization in implementing successful projects that were aimed towards enhancing the national HIV and AIDS response through capacity building of key populations, frontline program implementers, and service providers. Also lobbying for better laws and policies and providing legal redress for HIV-related stigma and discrimination. She led the network to Stop AIDS Philippines, a network of 27 HIV civil society and community organizations in successfully lobbying for the passage of the HIV and AIDS Policy Act of 2018, otherwise known as RA 11166. Ms. Quesada has conducted numerous training seminars and workshops on HIV, gender, and sexuality, including sexual orientation, gender identities, and expressions, also called SOGI. Human rights and migration issues for various groups, civil society organizations, government and academic institutions to enhance the HIV response at the local and national levels. Additionally, she has conducted skills building workshops on participatory action research, facilitation, and advocacy skills in the Philippines and in the Asia-Pacific region. Among her other engagements include being the principal representative of ACHIEVE in the Philippine National AIDS Council. She's a member of the advisory group for communities, rights, and gender of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, as well as a developing country NGO delegation member of Stop TB Partnership. Ms. Quesada was the civil society representative to the country delegation of the Philippines to the United Nations High-Level Meeting on AIDS in 2016 and then again in 2020. We now turn the virtual floor over to Ms. Amara Quesada.
Thank you so much, Dr. Manelastas. Good afternoon, good evening to everyone in the room, to our more than 500 listeners. Thank you for spending your evening with us. I'd like to share my screen. So I was asked to talk about the human rights, primarily in relation to the Republic Act 11166, pertaining to the context of people living with HIV and accessing COVID-19 vaccines. No? So I have to share a disclaimer first. When I was asked to do this, I actually suggested that it might be a good idea to get a lawyer to speak about this, in case people in the room would want to have a more legal discussion. But given the types of questions and comments that are coming in, I think this is going to be quite productive. But as Dr. Manelastas mentioned, we were really closely involved in the drafting of RA 11166 when it was still a bill, and we saw it through until it was actually signed into law. So I'm very honored to be here with you this evening to share our experience with working with communities of people living with HIV in relation to this current pandemic that we're all dealing with at the moment. So I'd like to start with specifying two provisions in the Department Memorandum 2021-0099, which is the omnibus guidelines on the rollout of the COVID-19 vaccines in the country. So beginning of this year, the government, along with other technical partners, as mentioned earlier, WHO and all this, the Department of Science and Technology, and all relevant government agencies started developing the structures, the mechanisms, and the guidance that would allow the government to deploy COVID-19 vaccines to the population. No? So, bakit merong why do we have priority groups? So that's essentially because we do not have enough vaccines. So the identification of priority groups became a necessary step in the deployment of the vaccine, because we have to make sure that with the limited supply of vaccines we are receiving, that we are able to vaccinate those most at risk and those most vulnerable to getting the severe forms of COVID-19. And also, the deployment of the vaccines has become one of the government's strategies to prevent further infection, no? Yung pagkalat ng COVID-19. And I'm specifying these two provisions because these were the ones that created some issues with the PLHIV community when they came out. So the first one is that before anyone gets a vaccine, they are supposed to go through screening, which includes an assessment of COVID-19 symptoms and comorbidities, contraindications and other important clinical information. And among comorbidities that were identified were those conditions that have to do with suppressing a person's immune system. And because it pertains to immunocompromised conditions, of course, HIV became part of that. No? So the second provision is about people living with HIV needing to consult their attending physician or primary health care provider to get a clearance before they get vaccinated. Dr. Angelo earlier mentioned this, no, na nire-require natin ang actually A3, no? So yung category A3 natin are required to provide medical clearance to be able to get vaccine. So it's not just people living with HIV. It's people who also have cancer. It's people with having specific conditions that are necessary to determine safety of the virus. That's at least that's the context of the guidelines that were issued by the Department of Health. When these guidelines came out, we started receiving concerns from the community, from the PLHIV community, if this meant they were being forced to disclose their HIV status. Now, being asked to provide a medical clearance from your physician would mean that you have a document stating that you have HIV and that your physician has cleared you to get the vaccine. No? So, and of course, the concerns were coming from the fact that there is still prevalent experiences of stigma and discrimination in the community. So naturally, people with HIV tend to hide their status, no, for fear of being discriminated against. They fear disclosure of their HIV status, especially those whose own families or own close circles and communities, those whose work colleagues or employers are unaware of their HIV status. No? And of course, there's always the chance that you would more likely get a vaccine within the vicinity of your residence. So, for instance, the deployment of vaccines through the barangays, for example, the chance of you meeting somebody handling the vaccine program, the chance of you meeting someone that you know, and then you're carrying a document that says you're HIV positive. That strikes a lot of fear in the community. But when I was asking members of the community about the experience, I was asking a number of community leaders whether they have members of the community who refuse to get a vaccine simply because of these conditions, simply because of these requirements. So far naman, wala pa daw. However, there has been experiences of PLHIV who have been refused vaccination because of the absence of the doctor who needs to provide the medical clearance. So I was asking about what the scenario was, what the context was. Apparently, because you can schedule your vaccine schedule online, so the person went ahead and scheduled the vaccine, scheduled his vaccination online. But I guess he's one of the lucky few who didn't have to wait too long before his vaccine was scheduled. But by the time that happened, he hasn't been able to secure a medical clearance from his treatment facility, from his doctor. And unfortunately, when he went to the vaccine site, the vaccination site, there was no physician who was able to give clearance. So they refused to give him a vaccine. There's also experience of people with HIV, particularly those who are registered for vaccination through their employers or their companies, who opt not to disclose their status. So they would rather not say that they're HIV positive, still got vaccinated. I haven't seen any data of whether there is adverse how do you call that, Doc Nina, yung sinasabi natin kanina, yung adverse events following immunization. We have not heard of cases of that yet from the PLHIV community. Hopefully there isn't any. Unfortunately, we don't really have concrete data to show, but we don't have that yet. So there are members of the community who are getting vaccinated without disclosing that status. And I suppose I'm not sure if I personally agree with that, especially with the context that it's for safety and efficacy that they're saying that the guidelines are requiring medical clearance from physicians. However, it is quite understandable because there is experience already of a PLHIV who registered through his company, who registered for vaccination through his company. And when he did disclose in the screening form, when he did disclose his HIV status and his company found out, the human resource head of the company filed the disciplinary action against him for being dishonest. And it's still an ongoing case. It's being handled. So I'm not privy to most of the details that's happening on the legal side of the matter, but suffice to say that there is experience of people living with HIV experiencing consequences when they do disclose their HIV status. Now, in terms of the fear of disclosure, the guidelines, fortunately, do have provisions that aim to assure that data being gathered from any person going through the vaccination program are protected. No? So all facilities should have a proper storage of all paper records, because when you go to a vaccination site, they make you sign those forms, and that includes the screening form that that the physician will or the healthcare provider will ask of you, that will indicate if you have other health conditions. It also includes a consent form. So all of these forms are supposed to be stored, and the storage should comply with health record management guidelines that ensures safekeeping and data protection. And again, I repeat, this is not only for HIV and AIDS. Of course, because of this, because of the context of the discussion now, there is a lot of worry in terms of disclosure of information, not just in the interpersonal exchange that happens during vaccination, but in the records that are kept and transmitted from the vaccination sites to the main repository of information and data. No, and again, the data privacy law via the National Privacy Commission that has issued guidelines has also been referenced by the guidelines on the COVID vaccine rollout. Deployment, that there is actually even a requirement to designate a data protection officer or a compliance officer for privacy. So there is really this intent to make sure that whatever information is disclosed in relation to people's health conditions, and in this case HIV and AIDS status, is kept private, no, and protected. And that's a good thing, no? Because somehow, I guess what's lacking is that we do not have, I don't think we have a lot of promotion programs that includes these kinds of information to assure communities who are wary of talking about their other health conditions, because it might not just be HIV and AIDS, you know. But yeah, if I had not had this opportunity to talk to you this afternoon, I would not have studied the guidelines as closely as I did. And I'm glad to know that they did have this intent of making sure that data is protected. And then we have the AIDS law, of course, RA 11166, which more than doubles the protection of any information related to HIV and AIDS, specifically provision on confidentiality of Section 44 on confidentiality. And I wanted to reiterate this because if you would notice, confidentiality and privacy is not just afforded to people who are HIV positive. they're also afforded to any individual who have been tested for HIV, regardless of the test result, has been exposed to HIV, even though that person may have not actually undergone any test yet, has HIV infection or HIV and AIDS-related illness, or was treated for an HIV-related illness. So all of these categories of individuals, no, the confidentiality of their information as well as their privacy is protected by the AIDS law. And disclosure of any of this information actually requires written consent from the person involved. So it can be the person who has HIV, the person who has undergone HIV testing, the person who has been exposed to HIV or is being treated for an HIV-related condition. But of course, there are exceptions. No? There are exceptions to confidentiality, and these are the following. One, for repertorial requirements of national disease surveillance, whether it's active or passive, you can, of course, transmit information pertaining to HIV-related information as long as the specific identity of the persons are kept confidential. That's why when you go to an HIV testing facility or when you undergo an a community-based HIV testing, they assign you a unique identification number, no? To make sure that when data is transferred from one hand to another, there is that unique identification code attached to you, but not necessarily all the other private information that you divulge in your HIV testing. Number two, when informing other healthcare providers involved in treatment and care of PLHIV. And I guess this is quite relevant in the case of the vaccine because, for instance, like if in the event that a person living with HIV were to experience adverse reactions from vaccination, then healthcare providers who are tasked to monitor the effect of the vaccine to the communities being provided with the service would know how to manage the condition, and if there's a need to refer these people to the proper service providers, healthcare providers, then the information of the added condition of HIV would be crucial to provide proper care and treatment to the people concerned. So the law exempts this from them. The other from the provision on confidentiality. And the third one is if it's a court order. So if there are cases where HIV status is material to the case, then the court can order the person can order somebody to testify as to a person's HIV status or could require records to be opened as long as that information is material to the case. Of course, even though the law is silent about this, our appeal is that in the event that health service providers do need to divulge HIV information to other healthcare service providers, that the person involved should at least be informed. No? So even if you do not require their consent, because the law exempts that practice from the coverage of confidentiality, from an ethical point of view, the person whose information is being transferred should at least be informed that there is a need to divulge his or her HIV status to other healthcare providers. The other concern, of course, is the experience of discrimination. Which I will go to in a while. I just wanted to also reiterate the penalties for breaching confidentiality. And I hope this does not come out as me scaring people, but to remind our healthcare providers, as well as other people working with people living with HIV, people who are in a position to actually know a person's HIV status, or people who have, because of their work, have access to records and data about a person's HIV status. And the penalties are divided into three categories. The first one is if you are an individual who was given the HIV information. This is quite common in the cases that we handle. You're a friend, a romantic partner, a sexual partner, a member of the family, a neighbor, whatever. For whatever reason, the PLHIV disclosed his or her status to you. and then somewhere along the line you have a fight, whatever, something, there's a conflict, and then you divulge his or her HIV status to other people, regardless of how good your intention is. And we get that sometimes from people who are involved in cases like this. They feel like they're just they're just doing the right thing. For example, I wanted to tell his boyfriend that he has HIV because I want to protect the boyfriend. I want to make sure that the boyfriend does not get infected because this person has HIV and his boyfriend is my friend. Things like that, no? Regardless of how good your intention is, however, unfortunately, if you do disclose confidential information without written consent, you can be liable under the law. And the liability is imprisonment of about 6 months and 1 day to not more than 2 years, and or a fine of 50,000 to 150,000. Now, this is only if you divulge information to another person that you know. But if you got ahead of yourself and went to social media and posted it on Facebook, again, we're handling a lot of cases related to disclosing HIV status of other people on social media, on Facebook particularly, no? Because that is mass dissemination, you put it up there, there's a lot of people who's going to be able to access that information. Then the penalty is going to be higher, and you can see that on the screen. So it's up to 5 years of imprisonment, 2 years minimum, 5 years maximum of imprisonment, plus 150 to 350,000 peso fine. No, and lastly, again, for professional breach, these are for people whose job it is to know a person's HIV status. So these are the doctors who attend to the person, the other medical staff, healthcare providers, the human resource people, the encoders, even community counselors, civil society organizations like us who work with people living with HIV. We are not exempt from this. If we are, by virtue of our work, of our profession, we are privy to this information. That means we have a bigger responsibility to actually make sure that this data is confidential, no? And so that's why the law gives us a bigger penalty if we breached confidentiality. So minimum of 5 years to 7 years imprisonment, plus 350 to 500 peso fine. Of course, this is under the discretion of the court, no? If they give us both penalties or one or the other in terms of penalties. Now I go to discrimination, which is one of the biggest fears of people with HIV, no? And the law has an entire article on discrimination, which is a prohibited act under the Philippine AIDS law. Section 49G specifically states that denial of health services or being charged with higher fees based solely or partially on actual perceived or suspected HIV status is prohibited. So if you would notice again, similar to earlier, no, this does not just apply to people who are actually HIV positive already. No, if you are somebody who is profiled and the person providing the service just assumed, tingin niya lang or suspecha niya lang may HIV ka, and because of that assumption or suspicion or perception, you are discriminated against, liable rin yan sa batas, no? So in the context of in the context of this provision in relation to the COVID-19 vaccine, that is a health service. So denying a person vaccination solely or partially on the basis of HIV status, perceived HIV status, or suspected HIV status is prohibited. There is also punishment for anyone who denies a PLHIV, a suspected PLHIV, or somebody just perceived to be PLHIV. Imprisonment of 6 months to 5 years and or fine, or both. Sorry, I forgot to put here that in the event that you are a government-run facility, there's also administrative cases that can be filed, no, against you, which would mean suspension, including pati pala sa confidentiality, suspension, revocation of licenses, or suspension and revocation of business permits. This may be my last slide. Ayan, that's my last slide in relation to COVID and HIV. I wanted to say though, and I hope we have people, our colleagues from the HIV work and the HIV community in the room. This is a big misconception when we talk about, there's always this big misconception when we talk about confidentiality. And that is because the law protects confidentiality, sometimes there is a notion from the community that nobody should ever ask if they are HIV positive. The law does not prohibit asking about anyone's HIV status. And in this case, the guidelines somewhat ask your HIV status, right? Because you're being asked to provide clearance from your medical from your doctor, which means that it's implied that your HIV status is being asked. The law does not prohibit that. No, so because in our experience, we get these kinds of complaints from the community that's how they understand confidentiality, that they shouldn't be asked. That's not what the law is saying. The law is saying that if you were to provide your HIV status, if you were asked and you gave and you disclosed your HIV status, that information needs to be protected. Your privacy needs to be protected. That's when the law comes in. But it does not prohibit anyone from asking. Of course, ibang usapan yung chismosa lang na gusto lang malaman kasi may chismis going around about you. We have a lot of cases like that. People around the person, pinagchichismisan siya, so there are concerned individuals who would directly confront the person and ask, so is it true? I've heard this kwento. Is it true that you have HIV? No, so ang kakasuhan natin hindi yung nagtanong sa'yo, ang kakasuhan natin yung nagchichismis, no, tungkol sa'yo. And in the case of the COVID vaccine deployment, I would agree though with Dr. Angelo, what Dr. Angelo said earlier, that we need to continue improving our system of deploying the vaccines to make sure that it is more accessible to the community, PLHIV communities, and well, the rest of the population. And it would really be good if we had better data. I highly appreciate, I'm very appreciative of the presentation from Doc Nina earlier, because these are the kinds of information that would be helpful to us, so that we can also help convince the community. Like fears, for instance, of whether there is contraindication between the vaccine and the ARVs. No, if this were not available publicly, you really have a lot of fears from communities, and that's gonna prevent them from accessing the vaccine. So I think with information available like this, with experiences from the community, we continue to gather data from the community to find out if they continue to be uncomfortable in accessing the vaccines that are being provided, so that we can help improve the system of deploying the vaccines to the community, and alleviate fears, if any, in the communities that we work with. Because sabi nga kanina, the benefit of the vaccine outweighs, the risks that people sometimes have in getting vaccinated. If you have questions, queries, if you know people who need legal assistance, particularly in relation to HIV and AIDS, you can contact us through this portals. Ayun lang po. Thank you. That ends my presentation. Thank you so much.
Thank you very much, Ms. Amara Quesada, for that outstanding lecture. Your lecture was truly informative, relevant, and very helpful. In fact, all of our speakers gave very excellent lectures, and I'd like to thank all of our speakers. Now, it's time for the open forum, and we would like to request our speakers to please turn on your cameras and your audios, no? And let us proceed with the open forum. We collected a number of questions from our Zoom participants and live stream viewers, and some have already been actually answered. Thank you, Dr. Angelo Ramos, for already answering the Q&A box. No? Unfortunately, we will not be able to answer all of your questions, and we truly apologize for this. But we have selected a few that can be answered by our distinguished speakers. So let me start with the first question, which is actually for Dr. Nina. No, wait lang. Where is that question? So the question to Dr. Nina is, Ma'am Nina, what is the implication of Delta and other emerging COVID-19 variants to the effectiveness of vaccines among persons living with HIV?
Okay. Well, I already mentioned that all of the vaccines have reduced efficacy against not just the Delta variant, but Beta, Alpha, but of course now more importantly ang Delta. So because PLHIV are more immunocompromised, then maybe that will be even much lower. So what we say is you do have to be very, very careful, double ano yan. Ako nga nagdo-double mask because I'm also immunocompromised. Marami akong sakit. Pero double precautions for everything. So ang nakikita nila na ano sa Delta variant, yung transmission or yung yung breakthrough infections from mga vaccinated individuals, yun talagang may mga immunodeficiency. And of course, yung pagmarami, nag-gather, kahit hindi ka immunodeficient, pag napakarami nyo nagsama-sama, kumain together, kwentuhan, ayan, dyan papasok lahat yan.
Pero Ma'am Nina, even if we say na-reduce ang efficacy niya, we still encourage people to get vaccinated because as Dr. Angelo Ramos mentioned, the vaccines are just one additional layer dun sa Swiss cheese model niya. So kahit na hindi 100, wala naman pong 100% kahit kahit anong gamot, kahit anong vaccine. So whatever efficacy, dagdagan pa ng mga minimum public health measures na talagang ine-encourage naman hanggang ngayon kahit vaccinated ka na. I think that will still add up, no? So, yun siguro Ma'am Nina ang ating bottom line ang ating message na kahit na may variant, kahit na reduced efficacy, kahit na immunocompromised.
Magpabakuna tayo. And 2 doses.
And 2 doses. Kompletuhin po natin ang doses natin. So next question, Dr. Butch.
Chet, can I follow up lang on that question kay Dr. Anina?
Okay.
Dr. Anina, is there a way to improve the response of a person with HIV to vaccines in general, but particularly to COVID? Anyway, we're talking about COVID.
For most of these vaccines, talagang medyo mababa ang response nila. So, we're actually considering recommending a 3rd dose for the
So, either a 3rd dose, no, siguro in the future. How about adjuvanted vaccines? Or maybe, ang general recommendation, if I'm not mistaken, Chet, no, mas ka sa vaccine sa akin. If you're vaccinating an HIV patient, time the vaccine during the patient's status of CD4. So, kunyari, okay naman CD4 count niya, doon mo siya i-vaccinate. Kasi you expect that the response, kung maganda yung CD4 count,
actually, dapat ganun.
Yeah. What do you think, Dr. Nina?
Actually, dapat ganun, no? Nakita nyo yung mga na-test, they have to be medically stable, of course. At yung CD4 may certain level that will give that response. Although, may sinabi ako yung 12, na kahit less than 350, may less than 200. Pero bihira yung gano'n, ha? Do not bank on that. So, dapat
Ma'am Nina, sorry follow up. in relation to that po, so kung hindi pa po nagsa-start ng ART, diagnosed, hindi nyo po ba ipapabigay ang vaccine at that time?
Well,
Newly diagnosed, wala pa pong treatment.
Titignan kasi ang viral load nila. They will have to be, dapat medyo mababa. Yun nga undetectable, mayroon silang cut-off. So they have to be...
dapat medyo mataas ng konti. Okay, so Butch,
okay. Thank you, Amina and Kat, for allowing me to expound, to ask them about that. This is for Dr. Ramos, no? So, Dr. Ramos, ang question for you is, this time is safety. Is it safe to have COVID-19 vaccine for an HIV positive mother? I'm interpreting that as parang not only mother siya, but baka pregnant at that time.
Well, I guess baka si Dr. Nina might be in a better position. Pero siguro, based on my experience then, yun na nga, if we're looking at an HIV positive female na possibly pregnant, and marami rin kasi conditions if for example, if that mother naman is on ARV, total, kailangan na rin yung mag-ARV para maprotektahan din yung baby niya na hindi rin mag-transmit, no? So kung if those conditions are met, yeah, pwede po siya magpa-vaccinate.
Okay, so safe naman and most likely as effective, no? Siguro, no? Yun ang parang sinasabi.
may add lang.
Okay, Nina, Dr. Nina.
Parang double ang kanyang ang kanyang comorbidity dyan So in pregnancy also gives you you're at a higher risk for more severe COVID din. So dalawa yan. So ang sinasabi dyan, kapag mataas ang exposure ninyo, mataas yung risk nyo, talagang kailangan magpabakuna. Pero yun nga, kailangan stable naman kayo.
Hey, thank you, Dr. Anina. Chet, you want to take the next question?
Yes, this is for Ms. Mara. Where can PLHIV, persons living with HIV, seek legal assistance should they experience violations of their status disclosure?
Thank you for that question po. There's actually a network of us, of civil society organizations providing free legal assistance. You can contact us via our Facebook. Just look for Achieve Inc. Send us a message. We have a legal clinic in our office every week. We can schedule for you to consult a lawyer if there's needed, but we have staff who have been trained as paralegals, so you can always talk to any of our staff to determine ano yung pwedeng gawin to provide the kind of assistance that you need. I also want to remind everyone that when you experience any of the violations in the law, there might be people who are afraid na the only recourse would be to file a case in court. That's not true. There are a lot of extralegal might not be the right term. There are a lot of other avenues. There are a lot of other avenues that we can explore. And in our experience, we've been successful in actually providing redress, even if we did not have to go to court. So that would really depend a lot on the cases that you experience, the kinds of violations, and also the openness of the other party, yung nag-violate ng law, to dialogue with us, no? Because in our experience, sometimes discrimination happens mainly because the other party is just totally unaware of the situation. They do not know that what they're doing is actually violating a law. And when they're made aware of that, they're actually quite open to fixing yung damages that they unintentionally
committed
or perpetrated. But please just go to Facebook. You can just type Achieve, look for Achieve Inc. and you can reach our website. Just send us a message. PM lang po. Thank you.
Well answered, Ms. Amara. Thank you. Butch?
Yes, we have major limited time, so let me ask this question. Let me throw this question to all our panelists na, no? Kasi it's really the meat of our webinar today. And the question is, how do we convince people to get their vaccine, their COVID-19 vaccines? And maybe I'll start again with Dr. Anina. How do you suggest we do it so they get convinced to get their vaccines?
I always approach yung may mga problems, so comorbidities. That way, na ito, getting the vaccine will save you or protect you from the severe form of COVID. And then, when you protect yourself, you also protect others around you. So, siguro yun, hindi ako masyadong marunong din sa communication. Pero siguro, hindi, short of nananakot, hindi ka naman mananakot. But you do have to explain na talagang the evidence, the data show na talagang mas mataas ang severity, hospitalization, critical care, even death, doon sa mga may comorbidity. So, an HIV positive person with comorbidities pa, medyo mas ano na yon, no? So, yun siguro. I don't know.
Thank you, Dr. Ranina. Now, maybe hear from Dr. Ramos. Same question, please.
Yes, well, based on my experience with our PLHIV clients, pagdating sa vaccinations, actually, it's not, in my experience, not difficult convincing them to get vaccinated kasi at least yung mga nami-meet ko talaga, from my experience, they're very acutely aware of their condition and they're acutely aware of yung risk, that they face pagdating sa COVID. So actually, I have a lot of cases that they're really more than willing, for example, to disclose their status kung kailangan talaga ilagay daw talaga sa medical certificate. So I just ask them, I just get their consent, okay lang ba sa inyo? Na ilagay yung condition na to sa medical certificate para kung papabakuna kayo. For those who say, sige, at least nakuha ko yung written consent nila. And there are cases naman na pag hindi sila masyadong comfortable na to give their consent, so I give baka gusto nyo ilagay na lang natin dito, you have an autoimmune condition. Ganon. So, okay naman sa kanila yon. So at least in really dealing with HIVs, they're very open naman to getting vaccinated. Actually po ang main concern ng mga PLHIVs is actually the access part. It's not really the willingness to get vaccinated, but actually yung access sa kayong supplies ng COVID-19 vaccines.
Thank you, Dr. Let me just follow up before I ask Ms. Mara for her turn. Of course, you're talking about PLHIV. That's understandable kasi nga ito yung rin natin topic. How about yung common people? Si Dr. Ranino din, sinabi niya, kung may comorbidities ka, yan ang approach ko. Approach ko yung comorbidities mo, telling you most likely pag na-COVID ka, ganito ang mangyayari sa'yo. PLHIV, mukhang madali lang din. Paano yung common na tao? Minsan, sabihin nila, wala, yung chance ko, ganyan. And some are even expecting monetary incentive, non-monetary incentive. What do you think about monetary and non-monetary incentives? Ganyan sa Amerika, no? Ganyan sa Amerika.
Kasi even the Philippines, di ba, meron pang, di ba, I think couple of weeks ago, di ba, namimigay pa ng bisikleta, di ba? Para lang magpapagmula. Nira-raffle.
Mananalo sila na raffle, no?
Ako in my experience in other cases, na hindi PLHIVs, since we are a very family-oriented society, I usually advise my clients, if you don't want to do it for yourself, magpabakuna, do it for your family. At least it convinces some of them.
Right. So that's, I guess, one good approach. Ms. Mara, this time, please, lalo na, maybe if you'll focus on legal threats, or withdrawal of privileges. No? You think that is
we won't scare the communities. But yeah, I think even if Doc Nina said she's not very good with communication, that's actually a very good core message, no? And it doesn't only apply for people who have comorbidities. I think for anyone, in the event that you do get infected with COVID-19, the severity of your symptoms is significantly lowered if you had the vaccine. And yeah, I agree with yung mga approaches that were mentioned earlier. Siguro I would just add the economic advantage of also being able to be you have a higher degree of confidence to continue working, continue earning a living for your family if you had an additional layer of protection, which is the vaccine. So even I guess for the general public, that should be the message, no? Na the vaccine, tama yung sabi kanina, the vaccine gives us an additional layer of protection so that we can continue going about our normal business. No, we can continue going to work, earning for our families, being with our families and not getting isolated because you got very severe symptoms, you know, in case you got infected, things like that. But I do, however, in the case of monetary, nabasa ko sa comment kanina yon, no, yung parang humihingi ng monetary incentives so that they get the vaccine. In the context of the Philippines, di ba limited na yung supply natin ng vaccines? Limited na po yung supply natin ng vaccines. So if we diverted funds and gave it as monetary incentive pa, the free vaccine is an incentive, no? Libre po yung vaccines na nabibigay sa atin ngayon. Of course, I'm also perfectly aware of the fact that there are big companies who have opted to purchase for their employees, no? And I suppose, you know, that's also a function of the fact that this is an emergency case that we are not prepared for. And I do wish, I'm sure there are a lot of people out there who do wish that this government was able to handle this better. And in line with that, I would siguro have a one key recommendation.
Nawala.
Ma'am Mara, Miss Mara, nakamute ka.
Opo, sorry. The key messages that came out from this webinar this evening, particularly the benefit of the vaccines, the information about, particularly the kind of information that can pacify the fears, assuage the fears of people who are afraid of taking the vaccines. If those kinds of information were actually be packaged into infographics that can be distributed to the public so people become more aware. One of the consistent problems since the COVID pandemic started is that we're never sure about the information we're receiving. And I think that's really where a lot of the source of panic, no, and fears are coming from. So if we had that, siguro yung promotion from DOH about the benefits of the vaccine and yung mas antig sa puso na messages ni na Doc Nina and ni Doc Angelo kanina about, you know, doing this for your significant others, for your loved ones, for your families, doing this for your own economic sustainability, then maybe we could convince more people to get vaccinated. But convincing people to get vaccinated requires that we have a sustainable supply of vaccines. Kasi ang hirap namang kumbinsihin natin ang mga taong magpa-vaccine tapos kulang naman yung supply. Ayun po.
So dapat talaga yung approach is comprehensive. Pinapabaksin mo, wala naman vaccine. So thank you. These are all very insightful messages from all of you, and we'd like to thank you. Unfortunately, we're almost out of time, so we need to proceed na to the awarding of our certificates.
Okay, so
would you like to give the first one to our Dr. Anina?
Yes.
Go ahead.
This is for our first speaker. So this certificate of appreciation is presented to Dr. Nina G. Gloriani for sharing her knowledge and expertise as a speaker during the third session of the HIV and COVID-19 webinar series, Who is Next in Line? Considerations and Guidelines in Vaccinating the PLHIV Community on July 31, 2021. This is signed by Dr. Carmencita D. Padilla, the Professor and Chancellor of the University of the Philippines Manila, and Dr. Don Operario, Professor of the Brown University and Director of the NIH HIV Training Program for the Prevention of HIV in Vulnerable Populations.
All right, let me award this same certificate of appreciation to Dr. Angelo Juan O. Ramos with the same citations. Dr. Ramos is, of course, the Executive Director of SHIP, or Sustained Health Initiatives of the Philippines. Thank you very much, Dr. Ramos, for all your contributions tonight. This last certificate is awarded, the same certificate is of appreciation is awarded to Ms. Amara Quesada the Executive Director of ACHIV or Action for Health Initiatives Incorporated. Maraming salamat po sa inyong tatlo, and hopefully this won't be the last time you will agree to join us.
Maraming salamat. You all deserve a big round of a virtual applause. Maraming salamat po. So, ganun na lang talaga no? Virtual applause na rin. So, let me just tell you about the next webinar. The next webinar session is entitled Community and COVID-19, a Roundtable with Community-Based Organizations. So this session will focus on the challenges, best practices, and recommendations for providing healthcare services. Sorry, I'm muted. I'm sorry. Baka di nyo ako narinig. So let me announce lang the next webinar session, which is entitled Communities and COVID-19, a Roundtable with Community-Based Organizations. And this session will focus on the challenges, best practices, and recommendations for providing healthcare services and advocating for the PLHIV community during the COVID-19 pandemic. So this fourth installment of the webinar series is scheduled on August 14, 2021, which is a Saturday, once again at 5 p.m.
Okay, follow us on our social media accounts for updates on our next webinars. Follow and like us in our Facebook page, which is UPM-Brown Webinar Series, and follow us at Twitter at UPM-Brown Webinar. And we wish to thank our media partners, Subselfie and Report R.
So we appreciate your feedback. Please answer the evaluation form on or before August 1. You may scan the QR code flashed on the screen or access the link provided. It would lead you directly to the online evaluation form. Certificates will be issued to those who accomplish the evaluation form. So you need to accomplish the evaluation form. Allow about 3 to 5 days for the certificates to be issued. We are not responsible for undelivered certificates due to wrong email addresses. So on behalf of my fellow moderator, Dr. Manelastas, and the HIV and COVID-19 webinar series organizing team, thank you for joining us today. We look forward to spending another Saturday afternoon with you in the upcoming sessions. Maraming salamat po at magandang gabi po sa lahat.